Welcome, Kris. We are glad that you are here. We are very honored to have your speech today. And we just started with a very interesting conversation and see that many of us are obviously interested in the same field. So let me just briefly introduce Kris. Kris Hartley is an assistant professor in the Department of Asian and Policy Studies at the Education University of Hong Kong. And as he already mentioned, his research is focusing power and knowledge and policy making. So focus on technology and environment. So we just talked about water management and climate change. So, but I know there's a lot of publications also in other fields, and I know that Kris is a fellow in several institutions. Just let me to highlight the Chicago Council of Global Affairs and the University of Melbourne. And he's doing his work, or he's presenting work done jointly with Darryl Jarvis, who's also professor at the Department of Asian and Policy Studies at the Education University of Hong Kong, and he's also working in political economy of development and public policy. So we are glad to have you, Kris, and we just started to discussing some issues, and I think we will have the opportunity to discuss your presentation, but also related issues later. So it's about 30 minutes for the presentation today, and then we have some space for a discussion. And many thanks again for coming, and many thanks for bringing all these nice ideas today.
Well, thank you very much. Thank you for that very kind introduction, Rahel. I really appreciate it. And I want to thank you and David for this exciting invitation to present. And thank you to everybody who's on the call and participating. And thanks for the original conversation. I hope we can get back to it. And Charles was very interested to hear what you had to say, and I appreciate that. Hope we can continue the conversation. I'll begin very quickly by saying that just as a matter of disclaimer, I am hoping that my internet doesn't cut out. It occasionally does. I teach often online, and sometimes I just disappear because my internet just decides to shut off. So if I do disappear, nothing bad has happened, hopefully, and just stay on the line, and I'll try to log back in as soon as possible. And just be patient with that. So I'll talk for about a half an hour, and then hopefully for about the remaining 25 minutes, we can have some discussions as well. So let me begin sharing my screen now, and please let me know at any time if you cannot hear what I'm saying or if you can't see the screen. I assume you can see the screen now, is that correct? Good. Okay, so if anybody would like to interrupt me with questions, or if something's not going right, just please type into the chat function or just yell. You know, we have only a small number of people here, so we should be able to have more of a conversational experience. So,
Kris, you might want to increase the slides, the screen, but it's not necessary.
You mean to go to full screen?
Yeah.
Like this?
Yeah.
Okay, sure. Okay, thank you for that recommendation. Sure. So, Rahel said a very thorough introduction. I really appreciate that. My background is to study public policy and the political economy dimensions of technology, smart cities, and then I'm merging that with studies on environment as well, as we continue to see digitization and smart, quote unquote, technological solutions to environmental problems. But so many of us have been pulled in the direction of COVID and pandemic studies and crisis management. I feel a bit sorry for the people who were already in that space. Their room is now very crowded. But I think a lot of us bring our own theoretical perspective to this shocking and catastrophic new topic that is really difficult to ignore. So I'm relatively new to the space of public health and crisis management, and I attempt to stay in my lane theoretically, and enlist the collaboration of others where I need to. So I'm going to emphasize this is work. It's coming from a paper that was published in Policy Sciences recently Policy and Society in collaboration with Darryl Jarvis at the Education University of Hong Kong. Let's see if I can switch the, there we go. So with that background, I'll just jump right into some statistics. This is easily obtainable on Google. These are statistics reported from Hong Kong official statistical office. We see the most recent count is new cases, 60 new cases, and a 7-day average of 69. Hong Kong generally considers itself to be in a fourth wave, which is a term they started using in late November, which always confused me because it always, to me, looked like a third wave. There was an initial one in April, and then one in the middle of summer. This one that we're in now is more sustained. It seems a little bit longer, a little flatter, and the government has introduced some new measures to try to mitigate the pandemic and the spread of it in the city. And these are measures and dynamics that we did not capture in our paper because, of course, the paper was published at least a number of weeks ago, I think probably 2 to 3 months ago by now. This gives you a sense not only of what Hong Kong's experience has been over time, but also relative to other countries, what the case numbers are. And we're talking here daily cases that are up in the low hundreds as opposed to in the United States. In the hundreds of thousands, although of course we adjust, even if we adjust for population size, Hong Kong's case counts are still relatively low on a per capita basis. I want to bring your attention to some research that has just been put out by the Lowy Institute in Australia. This has just come out less than 24 hours ago. That I'm aware. And this is a long-running study that has now been put together and published, comparing various dimensions of governance and how they align with the effectiveness of crisis response, pandemic response, specifically COVID-19. We see better and worse. And then, of course, we see some of these classifications of government democratic versus authoritarian. We can debate which one of those Hong Kong is. I guess perhaps we could say that Hong Kong was a form of democracy, but moving in certain ways towards authoritarian. So perhaps somewhere along here, Hong Kong is making that transition. Authoritarian states, of course, seeing initially quite quote unquote good response, but seeming to fall, and there seeming to be a convergence over time. Same thing with small, medium, and large states. The research from the Lowy Institute comparing population size and effectiveness of COVID and seeming to converge a little bit there. Developing and advanced countries as well, seeing kind of a convergence. And I think what's interesting about this is hold on, let me go to the previous one here, what we've seen across all three of these is a convergence. Now, I don't have access to this data and have not had time to sift through their explanations, but asking why there is a convergence over time would be an interesting point for research. And just want to draw your attention now to their ultimate ranking, which is what a lot of this had to do with, was to rank responses. And this literally just came out. I think this is the first that I know of ranking, at least global ranking of responses to COVID-19 that is sort of data driven. And New Zealand and Vietnam, so I have a paper coming out about Vietnam pretty soon, has done quite well. And then we look at the bottom several countries, the usual suspects here, the US doing very poorly. We've heard stories about Brazil not doing very well either, and Iran, about which I have another paper coming. So it's really interesting to see Hong Kong is not in this, and China was not included due to a lack of publicly available data on testing. So testing is a part and parcel or a component of this index here that is ranking COVID-19 response. So another thing, before I get to the paper that Darryl and I wrote that I want to draw your attention to, is I'm going to show you some data here that is also hot off the press. Just received this data from the polling organization about 2 days ago. Rakuten Insight in Singapore helped us conduct a poll of 2,500 Hong Kong residents concerning their perceptions about the government's response to COVID-19. And this is a collaborative effort with Aaron Martin and Eric Bakeskav at the University of Melbourne that is replicating a similar survey that was conducted in Australia as well. Not only just direct survey about public perceptions, but also some responses to scenarios that we presented and others to try to gather what public perceptions might be in certain circumstances. So this is not published yet, and it has not necessarily been analyzed. We have not applied any sort of bivariate, even it's only univariate, it's not done bivariate analysis, nor have we done regression analysis on this yet. I'm just sharing this with you because it's literally right off of an email that I received a couple of days ago. And we can observe some patterns here in terms of public perception among these 2,500 people surveyed about approval. We see disapproval being a little bit higher than approval. And we see a little bit more clustering around neutral here when we talk about rules designed to reduce the spread of Hong Kong and their fair application. Also, perceptions about whether these rules have been successful tend a little bit towards either mid-level or disagree. And then how much do you trust information by medical scientists? So we tempered a lot of our questions about government with people's attitudes about doctors, scientists, public health organizations, et cetera, to see if they tracked the same way. And generally what we have observed is predictably a bit more trust in the experts, the medical experts, than in the government. So this is probably something that we could observe between, and we will observe between Australia and Hong Kong, and probably had we run this survey in many other countries, we would have observed the same thing. Then we asked a little bit about some of the measures, specific measures that have been taken. These measures we documented, Darryl and I documented in the Policy and Society article, and this is our first look at how people have responded to them, at least through this survey. Strong support of wearing face masks, and I think that's been one of the very interesting patterns. When I was speaking a little bit earlier about the politicization of science, et cetera, and I can't help but compare this situation to the United States, because news out of the United States is so noisy and ubiquitous, and because that's where I'm from and I have some degree of interest in how well they're doing. The wearing masks, of course, became a political, or not wearing a mask became more of a political statement than wearing a mask did. But across Asia, wearing masks, at least in Hong Kong, and I gather we would see similar results in other countries, it seems not to be something people are terribly reticent to do. I've observed in my 15 years of visiting and roughly 10 of living here that people who were using them already for a variety of different reasons, many due to some fear about air pollution, but also protection from just common flu and cold as well. So it was not unusual to see people in masks, and certainly not unpredictable to see people support that as a mandatory regulation. Travel restrictions for people in affected neighborhoods is very interesting. So keep this data in mind right now, that generally support this 3, 2, and 1 up to strongly support. And yet what we've seen just in the past week is the imposition of lockdowns on certain neighborhoods in Hong Kong. So we're going to get to really test whether people truly support this. This had not been a measure that was deployed by Hong Kong before now, and now it has been. So the area of Jordan, which is a very, very dense neighborhood, which is saying a lot by Hong Kong standards, in the Kowloon area of Hong Kong, was locked down. The lockdown ostensibly was to ensure that every person in the neighborhood got tested. So it was not necessarily lockdown in a quarantine sense, because it would have had no real clinical effect, because when you lock down for 1 or 2 days, clearly you're not isolating people for the 2 weeks that are generally recommended for isolation and quarantine in most countries. But this was specifically to deploy personnel to test people. I believe out of these tests, only 13 cases were found out of 10,000 residents. So quite low, and there's some theories as to why this happened specifically in this neighborhood, but we can get into those another time. Again, here we see mention of fourth wave, and this is in an article that's just 2 days ago. Again, I still don't know why they keep mentioning fourth wave. I think it's a third wave, but some people think it's a fourth. Now we're seeing terms like ambush style COVID-19 lockdown. That's a really descriptive way to describe it. And I believe it reflects the fact that the government is collecting information about likely or potential hotspots, and it wants to move quickly and wants to be seen to move quickly. So it'll announce a lockdown very quickly and implement it in a very stringent and restrictive way. And here we see a neighborhood that is near Jordan, not too far away from Jordan, another dense neighborhood, being locked down. This neighborhood lockdown comes from what I'll talk later about as a social memory or institutional memory that coming from SARS. So you may remember severe acute respiratory syndrome in Hong Kong in 2003. And it was a significant pandemic within the city and spread throughout Asia. But even within Hong Kong, it was highly contained to one particular area in Jordan Valley, which is not the same Jordan as this Jordan, and particularly to a housing estate called Amoy Gardens, where some faulty plumbing was responsible for the transmission of the virus in the air to people in the same apartment tower, up and down, higher and lower floors. And hundreds of people were infected, and a high percentage of them, I think upwards of 10%, died. So this was viewing the pandemic outbreak as a highly localized phenomenon certainly has a justifiable precedent in terms of policy. And yet, and we do see people that have supported that conceptually based upon our survey. But it will be interesting to see as Hong Kong moves forward with these ambush-style lockdowns. We wish we could do sort of a pre and post survey, because I imagine it's going to lose just a little bit of support, and particularly among the people who are affected by them. And then we have the policy limits on Hong Kong citizens and permanent residents returning from overseas. Another very big and very interesting recent development. So you see the screen capture from last month. Hong Kong was, by what I can tell, the first country or place in the world to institute a 21-day quarantine for arrivals. And I've asked friends, I've asked colleagues, if there is scientific justification for a 21-day quarantine. The only other 21-day quarantine I've been able to determine was in the United States among the Big Ten Collegiate Football League, in which teams were locked down or forbidden from playing for 21 days after their first cases. So there it was generally regarded to be an abundance of caution. Here, and people I've spoken with, it generally seems to be a deterrent. So it's not so much that there's a clinical justification for 21 days as opposed to 14 days. I myself served a 14-day quarantine in hotel back in August when I came back from the United States. But it serves a secondary purpose, which is a deterrent. It deters people who wish to leave, thinking, oh, well, I can handle 2 weeks. Well, in this case, there may be the marginal effect of an additional week may actually be quite consequential for some people. And thus, it may discourage people from leaving and coming back. Also, it's been stated that returnees would need to serve quarantine in government facilities and not simply at home. That's a big difference as well, especially because the conditions in government facilities so far have not been reported to be very good. The food isn't good, and especially that there have been some cultural problems, including people who are Muslim coming back and not being provided with halal meals, etc. So this has been quite a big point of conversation. So again, Hong Kong residents appear to support this, but we'll see how durable that support is once this 21-day restriction in quarantine really begins to settle in and have some severe effects. So this brings me, this is a nice backdrop, and this is all very recent, to the paper that was published a little bit earlier in the year in collaboration with Darryl Jarvis. And what we wanted to look at was how Hong Kong was able to respond relatively successfully in the early stages of the pandemic, despite there being such low levels of social trust and trust in the government itself. So I was very pleased to be able to collaborate with Darryl on this, and proud of the product. We not only sort of dug into some concepts of policy capacity in a way that may point that research in a new direction, but also I believe we fairly well documented some of the early responses and early policy responses and set those against public perceptions about those responses. And this is what I mean. So if you look at the paper, we have documented, we have sort of research assistants documenting the many different types of policies that Hong Kong introduced. Now, this is not to say Hong Kong was extremely aggressive from the beginning, but in the policy response gradually sprawled out over different policy domains over time. Initially, it was about border restrictions. Gradually, we saw introduction of quarantine. We saw social distancing guidelines, shutdowns of schools, work from home provisions for public employees, and the most recent iteration, which is just a complete shutdown of sports facilities, restaurants after 6 p.m., a restriction of 2 people per table for restaurants before 6 p.m., no bars open, no clubs, etc. So it's gradually gotten more and more stringent over time. And I'm not going to go through each one of these, but on the next 4 slides, I have December, January, February, March. And the point I'm going to make here is the pattern of people's dissatisfaction. We've placed dissatisfaction in these red boxes to make it stand out, and these are the points at which these surveys were taken. They were done by the Hong Kong Public Opinion Research Institute, which used to be affiliated with the University of Hong Kong, and now I believe it's independent. So this was December, a rash of measures. Then we, did we go into January in that? Oh yes, okay, so we go partly into January, yes, December and January. And then into February, we see dissatisfaction ticking up just a little bit. Postponement of entrance exams, college entrance exams for secondary students, other types of restrictions on border checkpoints. And the dissatisfaction level reached its highest right around late February and early March. The 2021 budget was put out in late February, and that, of course, understandably included significant amount of appropriations for a pandemic response. But look how it begins to fall as we continue to see sort of multiple different complex types of policies, including quarantine for people from certain countries, back when certain countries appeared to be doing better than others. Dissatisfaction seemed to be falling a little bit from 60. So remember, it was the high of 76, and it's falling into the 60s. And then there were funds, relief funds announced, 10,000 Hong Kong dollars given to struggling businesses, et cetera, social distancing regulations, and other types of funds appropriated for helping stimulus occur. People's dissatisfaction going down to 55% and then 50%. What's interesting is just, as these measures piled up, the dissatisfaction began to fall. So it appears as though people wanted more stringent policy reaction from the government. By May, Hong Kong had not entered its so-called second wave yet. So had we been able to measure this dissatisfaction through the summer, I think we would have seen dissatisfaction go back up, because all of these rapid measures would have apparently not been quite as successful in preventing that next wave. So with all of that as a background, so I've laid out at least some of the data and some of the very preliminary levels, sort of descriptive analysis of what's been going on in Hong Kong. Darryl and I asked ourselves, okay, well, how can we approach this from a theoretical point of view? And as many of you know, the notion of policy capacity has been very intricately developed in recent years. Variations of policy capacity go back quite some number of decades, but more recently, scholars like Khalid and Ramesh and Wu Jun have developed this policy capacity framework, which helps to subdivide elements or dimensions of capacity into something that could be a little more operationalizable or provide a little more intricate analysis. There are levels and skills, levels individual, organizational, and systemic, and then skills being analytical, managerial, and political. I and some colleagues used this to analyze policymaking for predicament situations. And we felt that this was a useful framework to engage with because it was being so intricately used. with colleague Jinggu Zhang and I also looked at governance indices like the World Governance Indicators, KPMG, et cetera, to evaluate which elements of policy capacity were receiving most mention and most measuring efforts in various indices, and found that system capabilities, political and system managerial, were the highest. Why is a matter for further research, but possibly because those are easiest to measure. But we see there quite a lot of differentiation among elements of policy capacity in terms of how closely they're paid attention to by, this isn't the literature now, this is actual governance quality indices, world governance indicators, and about 3 to 4 others as well. And I stress that this slide is from Wu Jun. So this is the product of, this content is from Wu Jun, who is one of the authors of that 2015 paper talking about or introducing that version of the policy capacity framework. And Jun and I were in a seminar together in October where Jun kind of laid out some of these different dimensions of capacity. If you're talking about the 3 types of capacity, we're not going into levels here, but we're just going into types. And of course, in any given situation, we have different combinations of them. And the theoretical proposition is that ideally you would have high capacity in all 3 in order to be able to overcome whatever crisis situation that you might have. So then the question is that from a theoretical point of view, does this policy capacity framework fully capture the dynamics that we observed in the Hong Kong case? Again, we start from the proposition that Hong Kong is a low trust state. There's low levels of trust in the government. So there's kind of a low level of political capacity. And yet Hong Kong, in the initial stages of the outbreak, I can't speak to the later stages because that's not what we examined, but in the initial stages at least exhibited fairly effective response. And does the policy capacity framework capture all of the elements of capacity that were responsible for this effective response? Our answer, of course, is no. Where are the people? And this leads us into the concept of sort of fragmentation of state capacity or policy capacity. We could get led into literature about privatization, the neoliberal movement, new public management, the growth of the third sector, et cetera. And when a lot of discussions about non-government capacity typically engage the third sector or NGOs and what I might call organized or organizational types of capacity. But also there's a type of capacity among the people just through their own behavior. And what's interesting is that we felt this was relevant to talk about because it really efforts to mitigate the spread of the virus are so personal and so individual. It really relies on individual behaviors. Mask wearing, social distancing, staying at home, working from home, washing your hands, all of these things are individual behaviors that can be done and are relatable to nearly everybody. So to what degree are they coordinated? And so people, we argue, it was the people who were the champion in this case. It was not necessarily government policies, but it was the behavior of the people. And the question then becomes why. So what compelled people to follow these guidelines so well, to conform, even in amidst a high level of distrust of government? Is it because they recognize the science independently of what the government told them? Is it because they have, in this case, a social experience or social memory from SARS? Not only does the government have institutional memory from SARS, but the people, many people that are alive and still remember the SARS situation and how frightening that was for many people in Hong Kong. And then combine that with this sort of sense of solidarity. And I don't want to make Hong Kong seem as though it's sort of unified in its opposition to the government, but we can't, and nobody can ignore the fact that there was a substantial amount of political unrest in Hong Kong in 2019. I saw it with my own eyes. I breathed the fumes of the tear gas myself, and this lingers. And the fallout of this simply can't be wished away or ignored. So there is a high level of distrust coming straight out of that. And what's so interesting is that the anti-government movement and the protests were at high tide in mid to late 2019. As the holiday season rolled around, they they kind of dissipated, and then all of a sudden COVID hit. So the protest movement never really gained traction again. And then you saw the very quick introduction of the national security law in Hong Kong, which really effectively eliminated the opportunity to protest at all. So the elimination of that opportunity does not necessarily mean that distrust for government dissipated, but certainly expressions of it were not quite as obvious over time. So the question then is, if the people have been championing this movement, how can we treat that theoretically? And the notion of community capacity, we found, is probably the most helpful way to do this. So we have various types of capital, organizational resources, social capital existing in a government community, can be leveraged to solve problems. Okay, now this still implies that there is a role for organizations and organizational types of approaches to this as well. But this is how Chaskin defines it in Urban Affairs Review. And what we propose, though, is, we can go to the next slide here, in reference more to collective action. So we might take an Ostromite type of approach to this, collective action in the commons or something, whether coordinated or otherwise, which is important, that addresses a problem within the domain of public policy. In this case, we could treat it a little bit as civil society, but we're really talking specifically about the behavior of people. So what we wanted to explain is, why Hong Kong performed well initially despite the low trust, and part of that community political response is rooted in perceptions of government failure, non-responsiveness. So there was a bit of criticism that at the beginning of the outbreak of the pandemic, Carrie Lam, the Hong Kong government, were slow to shut down borders with mainland China specifically. For what reason? We're not going to hypothesize about that, but the perception was that it could have been done more quickly, particularly because China was perceived to be the place where the virus originated. So this was a source of continued to sow that kind of distrust, and we could hypothesize that people felt as though they had to act on their own because the government was not quite acting as quickly as possible. So now, what did this look like, though, substantively? I bring up at great risk the name Joshua Wong, who is a sort of a bête noire of the Hong Kong government. He's been leading protests for quite some number of years, including the Umbrella Movement back in 2014. He created a political party called Nemezisto, which has now been outlawed. And his original goal, of course, was to bring attention to the fact that China may be violating some of the one country, two systems protocols that were agreed with the UK in 1984 for the 1997 handover, but that there was an opportunity to look at this lack of response and say, well, we can help the people, we can mobilize ourselves. And his organization, his leadership and the people that he knew and the communication capacities that he had through Telegram and other types of phone apps was able to procure face masks for lower income people in the absence of Hong Kong actually doing it. And so they were out in front of the Hong Kong government in terms of distributing face masks to disadvantaged populations or low-income populations in Hong Kong. You see this article from February 12th of last year. Gosh, it seems it's about a year ago now. It seems so much more recent. But they imported and gave out these masks before the Hong Kong government actually came up with an official policy to distribute these masks. So this is one instance in which this kind of community capacity, whether you want to classify his movement as an NGO, a political movement, etc., but it represents sort of non-government, non-corporate types of initiative to try to address this problem. And in fact, that was, you saw the date on that was 12 February. And then it wasn't until 7 May did the government finally organize a reusable mask program where they gave out the masks. And Carrie Lam announced this. And there were sort of immediate concerns about access to the masks, privacy concerns because there was some information needed to be gathered, et cetera. So there was some connection to draw between the public or political sentiment that carried over from the protests and how that galvanized a sort of a community-based or grassroots response in the face of crisis. And in this community-based, here we describe it as community-based political mobilization was a key resource. And so through whatever kind of institutional sort of structure, overarching structure that occurred, it happened. So we could combine that with the social memory of SARS and say that these are two of the factors that are not necessarily specifically related, but there are two factors that contribute to the willingness of the society itself to move forward on pandemic response, even independent of what the government appeared to be trying to do or appeared to not be doing well enough. So as I began to kind of draw a conclusion to all of this, I sort of bring your attention to this other work that I've done with Ola El-Taliawi at Carleton University in Canada, talking about bringing a soft systems approach to the COVID-19 crisis and complexity, and thinking about how we move through these various stages, defining a problem, how are problems defined and expressed, how are the root definitions identified, and how are they placed into sort of an epistemic frame in a systems thinking context, and then how is that translated politically for consumption by political leaders or consumption by the general public. I believe this is a good opportunity to reveal or to study the role of civil society and individuals themselves in how to define a problem in a crisis situation and how to determine what pathways and solutions might be appropriate going forward. So, and I can talk more about that if necessary, but I am conscious of time here. I'll just throw in a shameless plug that, as I've mentioned at the beginning of the presentation, I think probably all of us have an emerging interest in pandemic response or crisis response, and I'm no exception. And many of my colleagues have expressed interest in writing about this through the lens of our own theoretical orientation. So this is the article about soft systems that is already out. Phu Minh Kong at National University of Singapore and I wrote an article about the sharing of fake news in the COVID-19 era and how governments and social media providers can disincentivize people from sharing fake news online, so something that can be applicable to almost anything, not just pandemics. An article that will be forthcoming very, very soon, probably within the next week or two, in Policy Design and Practice on Vietnam's response. And of course, we saw earlier that Vietnam is rated the #2 most effective response in the world by that Lowy Institute index. And then with Journal of Asian Public Policy with colleague Hamid Sajadi in Iran, talking about Iran's COVID-19 response, and then finally another paper with Phu Minh Kong. So I'm trying my best to, again, as I said, stay in my lane. I'm looking at policy capacity. I'm looking at the political elements of politics versus science in a way, if it's a versus or if it's an and, we can debate that. And just trying to bring a little more clarity to this and establish some opportunities for us to look a little differently at some of these theories that we've been discussing for so long. So anyway, I'll bring that to a conclusion. Let's see if I can escape. Just one moment. I will stop share. It's a little bit tricky. Yes, I believe I've gone on for 30 minutes, so perhaps I should stop and open the floor up for questions. Thank you for listening.
Kris, many thanks for this fascinating speech. So I think many issues have been brushed on, and I just leave the floor to Charles for a first question. And yeah, please, Charles, go ahead. And if there are further
Thank you, Kris. Thank you very much for this. I've been scribbling away on my notepad with notes to myself saying, get this article, read that article, get Kris's slides, and so forth. I think this is tremendously interesting as a political scientist. And you said you're sticking to your lane, but I think your lane is actually a bit of a kind of dual carriageway motorway, because there are other areas of theory with which I think, or not so much theory, but analytical perspectives with which I think this is compatible. And it brings to mind the concept of resilience. And I've done some writing on the concept of resilience about how people organize themselves to in the face of threats and so forth. Now, we didn't develop the model in terms of levels of trust and so forth, and it was resilience to not to COVID, but to surveillance. But one of the important things that we were thinking about in that work was that it's a question of how the threat is perceived. And here you're talking about a response to a policy problem. So it's the perception of threat in resilience terms. How do you respond to the threat? If the threat is a sudden one, that's different from when it's like a frog being boiled slowly, you know, in the water with the temperature keeping up until the frog is dead. So you may have to, it may be useful to look at how people perceive what the threat is of the virus. When do they perceive it? How does that relate to their ability to self-organize, to relate to existing civil society structures, and also communication networks? Because if it's collective action, it implies a kind of coordination and communication. And I think those dimensions might be additionally important to analyze in relation to what you've done. So I don't want to say any more, but thank you very much. I think that I'm sort of dying to read your articles.
Well, thank you very much, Charles. I really appreciate those kind words. And I think that the notion of problem naming and framing is something that is particularly salient in our discussions about the epistemic foundations of public policy. So how do we understand what is a problem? How do we define it and measure it? And how do we understand the unmeasurable parts of it? And your comments are, I'm a little regretful that we didn't hold this a little earlier, because I think we could have put some more questions into that survey we just did about what really convinced people at the individual level that this was serious. Where did it go from just being an item on television to something that I need to be a little worried about? And I think that has a lot to do with what people feel like their relationship between expertise is, between them and expertise, between them and authority, between themselves and the rest of society. I think those are relationships that kind of mediate how people define what is a problem. And again, I hate to keep harping on it, but the United States is just such a fascinating and tragic example of how the evidence about a crisis can be used in political ways. And I just, and I really hope and anticipate doing some studies on that, even though I'm from the US, but I don't actually study the US very much academically. It's such a wild and crazy place. But it would be interesting to see, you know, in what other countries that this politicization of problem definition has happened. This, you could even say, sort of marginalization of it, right? Well, it'll go away. It's not really a big deal. It's a lie. People who are dying of COVID are dying of other things. They just have COVID, or whatever the cases might be. All of the narratives that come into play to try to undercut whatever efforts there are to convince people to act. And what do countries you know, where that see that politicization, what do they all have in common? You know, we see a little bit of that in Brazil. We see a little bit of that in the UK, but I don't think nearly at the scale that we saw in the US. And I can't imagine it really being present anywhere across Asia as well. So, I mean, is it a collectivist mindset? Is it a trust in science? Whatever those cases might be. But finally, just to conclude my comment to your reaction to your very initial an interesting comment. As I and a colleague in Indiana are just wrapping up a manuscript where we're talking about sort of the epistemics of public policy, the new epistemics of public policy for the 21st century. And our argument is that much of how we think about public policy, including defining problems, problem definition and framing, is rooted in sort of an Enlightenment, Taylorist, instrumental rationalist mindset, a mindset that basically it's you can't manage what you can't measure, and that our progress in technology and our progress in research that tells us how to manage public organizations better, all the rest of these types of things are rather technocratic approaches, and that our response to the failures of technocratic approaches is to double down on technocratic approaches. So, well, we don't have enough technology. We don't have enough expertise in doing the things that we already do. And we're arguing that we kind of have to throw all that out and rebuild our notion of public policy. How do we define problems? How do we define the relationship between politics and truth? And how do we create space for what we call other knowledges? So knowledge is outside the realm of science. And we have to recognize, of course, that there's a lot of contestation about these types of knowledges because they affect people's lives, especially this. The final thing I say, sorry, because you brought up so many interesting things, is you talked about a slow evolution of a problem. And I think I referred to this a little bit before I started talking, or before I formally started talking, is that, and I would ask this to anybody who's on the call today, can we look at COVID-19 as a condensed timeline for the type of challenges we're going to face in climate change or global systemic collapse or whatever the case might be, that people recognize COVID as a problem because it's so salient, it's so in front of us, and it happens so quickly, and it's so undeniable. And yet something like climate change, our ability to see climate change or to interpret it or understand it at the political level among just common people is mediated through our trust in science. We're not seeing necessarily, some people are seeing floods, some people are seeing droughts, some people are seeing the consequences of extreme weather. That's happening in certain places. But in other places, these effects aren't quite as apparent because societies are able to protect people or buffer people from the effects of climate change. There's no interruption in food systems. There's no interruption in their daily lives. Is it that people simply don't care, or is there something that is blocking them from respecting the science and responding to that politically? So my attitude is, let's take what we can learn from the COVID situation in terms of its politics, and let it help determine maybe a new course of research on how these issues are approached in the context of climate change, especially science and truth and politics. So thanks for all that, Charles. I'm happy to share those with you and hope we can continue the conversation.
Good, thank you.
Yeah.
Thank you.
You're welcome. Thank you.
Are there more questions, comments from the auditory?
Hi. First of all, thank you for a very interesting talk. It was illuminating. I have one question and maybe one remark, or I would like your opinion. First, I was wondering, maybe trust in this specific crisis is less important, in that sense that if we look at alternative explanation, maybe looking at the individual level, it's a little bit in continuous with Charles' understanding, looking at fear, for example, and you stated that in Hong Kong, at the first level, the basic levels of fears from disease, etc., is higher than in other places. So maybe the acceptance and the outcome of the government policies is partly an individual and cultural aspect that we should consider as an explanation. And the second thing that I'll be happy to hear is a little bit about the slides that you show at the beginning regarding the convergence of the different countries. So what can you say when you talk about the specific case of trust in Hong Kong, if at the end we can see the convergence between different countries? So maybe it's not a unique case and all of the country converge in a way in the same line of policy. So it's another interesting thing that I would be very happy to hear about. Thank you.
Thank you very much, Lee. Very interesting points and questions there. The first one is an excellent point and something we have to confront, and that is the uniqueness of the case. And we try to be as upfront as possible about the factors that make Hong Kong a bit unique. There weren't too many countries that had massive protests, anti-government protests in the period immediately leading up to the pandemic. So that sort of conditioned or predisposed people, some people, or you could say many people, towards sort of a bad sentiment or bad feeling about the government. And then the other side of that is as well, not only the solidarity, but also the social memory. So, there was an institutional memory in Hong Kong. Actually did a fairly good job of mobilizing their medical resources. And I'm sure that after SARS, there was the authorities reflected on that opportunity to prepare for the next crisis. And then here it came. But also at the personal level, at individual level, people remembered that. Were there cases? It would be interesting to look at cases around the world that appeared to exhibit community capacity in response to COVID and ask those same questions. One, were people predisposed to trust or not to trust the government? And two, what could have been in their past that would have conditioned their thinking about the pandemic? As Charles said, how quickly might they think of it as a problem based upon their experiences of something in the past? You could look at perhaps Ebola in Africa. You could look at H1N1. You could look at Zika, if you remember Zika, or even SARS as it existed in some other countries as well. Or are there other types of crises that might predispose people to react to a crisis? So a political crisis, economic crisis, even a natural disaster like an earthquake or something. Are people oriented towards saying, okay, something bad has happened, now we need to point ourselves towards solving this problem? What's interesting in the Vietnam case, although I'm not presenting that here, one of my colleagues, Sarah Bales, who's a longtime Vietnam resident and one of the top health experts there, said she even goes back to the Vietnam War, which they call the American War, of course, as a factor that fed into a national consciousness or a national personality that was, in the face of a threat, we mobilize and we come together. And despite a fair amount of distrust of the Communist Party in Vietnam among citizens, that on this issue, there was a fairly high degree of satisfaction and compliance with those things. So they were predisposed based upon a war that happened 40 plus years ago. That can't be the only explanation, but perhaps it's lingering in some ways. So I think that's fair to kind of look at that and similar factors. As far as the convergence, honestly, this came out 20 hours ago, and so I've just taken a look. I haven't looked at the data underlying it. I've only looked at the representation of the chart. In fact, if you like here, let me just share it for the benefit of everybody as well. I'm going to share this again. Hopefully you can see it. Again, we're talking about different types of states and governance structures. Authoritarian appeared very high, then fell quickly. So there's a lot of variation here. I'm wondering if some of this variation, and your guess is as good as mine at this point, does it have something to do with either, maybe it's methodological, maybe it's the way things were measured, maybe it's the reliability of data systems to monitor various factors about pandemic response could have been introduced or improved, or capacities to monitor it could have been improved over time. Maybe they weren't completely functional or as functional as they could be at the very beginning. But also, we'd have to look at the underlying factors under these scores to see why, for example, authoritarian states manage very well. I mean, I think many of us here who have perhaps a political science or public policy background could give some pretty plausible hypotheses for this difference right up top, right? That authoritarian states can act quickly. There's not a lot of political pushback in a place like Vietnam or China, and as opposed to the United States. So, it's the proverbial, you just sort of snap your fingers and close the border, snap your fingers and force people to stay home. That may have been why authoritarian regimes were sort of quick out of the gate. We look at small, medium, or large. I don't know how much we could interpret from those factors as well. I'd be perfectly interested to hear what hypotheses people might have about that. and developing and advanced, of course, would just be, I guess, a matter of resources. So, advanced were slow out of the gate. Maybe there's some interaction between advanced and this type of governance regime. Maybe advanced economies, quote unquote, as Lowy Institute defines them, are more of those are democratic. So in a way, you're seeing that variable show up in this data. And then, of course, over time, perhaps in advanced economies, their analytical capacity, their scientific capacity, their expertise capacity allowed them to increase their performance on this. And then, of course, why would it start declining? I mean, there are all sorts of interesting questions to ask and sort of inflection points here. So I think it's a fair question. As this was out only 20 hours ago, I think it sort of deserves a little more investigation. But I'm happy to hear any sort of initial off-the-cuff reactions to that.
Thank you. I would only think about policy learning and the fact that different countries learn from one another, and something about the convergence is maybe partly connected to policy learning from the different countries and policies.
I'd say it's a very convincing explanation. Absolutely.
Thank you.
Thank you.
If I may jump in at this point, because we are just coming near to the end, but I still take a question or two if there's any, but let me jump in, and I find it very interesting, and it relates to what you just said, the policy learning issue. I'm not pretty sure what we had a survey on trust in government and public administration at the time of the COVID pandemic, and what we see interestingly there is neither a correlation between the overall trust, the social trust in the society, and the compliance of the citizens, nor there is a correlation between the measures and the initial trust level of measures undertaken by the government at least in the short run. But in the long run, I think many measures just were aligned in a way. So some countries started with something in the beginning, and then they added other measures, while other countries just went the other way around. So I think this may lead to that convergence. I think if you just have a look on that specific periods, we find a lot of variation. So democratic states added measures later on that they try to avoid in the beginning, while less developed countries or emerging markets started with these measures exactly. And I think this also stems from the correlation between advanced and or less advanced and non-democratic regimes. So, but I think this is a fascinating topic that also could be observed within other crises, not only the COVID pandemic. And I like your idea of linking that to climate change. We try to link that in some of our research to the past, to the refugee issue, to also other crises. So this also may just deliver additional knowledge. So, and I also agree that the cultural issues, which are somewhat under-researched, the collectivist issue you mentioned, this also may be something relevant in that context.
Yeah, I think so. I mean, collectivism versus individualism. I mean, it's kind of a binary that honestly some of my colleagues don't really believe exists. So I've had a kind of debate even with Eric about that. But I think there's at least, that's a variable that could be thrown in there as at least as a control variable. But I agree that, as Lee mentioned, very perceptibly so, that there's a policy learning effect. And I wonder if you were to sort of disassemble that, if you were to create a basket of policies that are the typical types of policies that any government would use to try to mitigate the pandemic. Even Anthony Fauci always says, well, it's the sort of three things: that put the mask on, social distance, and wash your hands, right? Those are the three things at the individual level you can do. And then sort of governments, you could also have kind of like a holy trinity of things to do, right? Cut people off at the border, monitor and track or trace cases, and then respond quickly to small flare-ups or localized flare-ups, something to that effect, right? So what's interesting then is what are the dimensions of what is being learned specifically, right? Did it not occur to some country to shut down the borders? Did it not occur to some country to mandate social distancing? Well, no, I'm sure that is, probably the type of knowledge anybody can Google and find out and see. So the learning would occur maybe on a secondary or tertiary level. So how do you implement these things? How do you build capacities to make, these things run effectively? So it's not just sort of learn them, but to do them well. And perhaps over time they have been done well. So can you still see me, by the way?
Yeah, we can.
Okay, because for some reason my computer just went over to Netflix, which is very strange. Can you still hear me?
Yeah, we hear you and see you well.
Okay, good. I'm having to change that. So never mind about that. Anyway, so yes, thank you very much for that. I think there's so much more research opportunity coming out of this, and if anybody wants to track me down, I should have put my email in the PowerPoint, but it's just hartley@hk.hk. You can just Google me, and I'd love to continue the conversation with anybody who feels like it's worthwhile doing a little discussion paper on this or kind of exploring some ideas.
Great, Kris, many thanks. So yeah, I think there's something in the text from charts, and I think this is also something very interesting. Much space for further research at your end, but also maybe collaboratively. So yeah, thanks again for your very interesting talk. I leave the floor to David, who may want to announce the upcoming events, and yeah, hopefully this will lead to a long-standing partnership between some of our researchers involved here. Thank you so much, Kris.
Thank you very much.
Thank you, Rahel.
Yeah, thank you very much, both. I will continue the publication of the series via the email, and it's also on TiGRE website. We are excited to have you here. We have regulars here, and we are looking forward for 2 more presentations next week. One by Jonathan Zeitlin and the group on risk regulation. And the second one is on credible regulation by Dan Carpenter from Harvard University. So see you again next week. And thank you very much all, and Kris especially.
Okay, thank you all very much. I got a couple of messages. Just want to say that my keyboard's not working. I wanted to respond to the couple of people who said, so I've got your email addresses. I'm at hartley@eduhk.hk. And you can find me. And please, anybody that's willing, let's continue the discussion. Thank you, David and Rahel, for this very interesting opportunity. And I really hope to be back, and look forward to just being an observer in some others of these sessions as well.
I'll send you an email. Keep in touch.
Great.
Have a good day, everybody. Have a good weekend.